Alyssa McCarthy. I'm going to be performing the medication administration today, so I'm going to scan the room. So the first thing I would do is I would go into the med room. I would make sure I had privacy and I had no distractions. I would not take any phone calls. I would not look at my phone. I would make sure it was quiet in the room. So now I'm going to compare the patient order form to the MAR. So we have Jaguar Jones, birthday 8/25/1963, birthday 8/25/1963, MR number 417-6352, MR number 417-6352, and his allergies include penicillin, penicillin. And so we have an order for heparin, 5,000 units, subcutaneously, every 12 hours. So the order is correct as well, so I can put the order form to the side and just keep the MAR. And so now I'm going to perform hand hygiene. And then I'm going to gather my necessary equipment, and I'm going to choose the correct medication. So we have heparin 10,000 units per milliliter, expiration 5/5/2021, so it does not expire. So we have heparin, and so since this is 10,000 units per milliliter, we are going to be injecting 0.5 milliliters for 5,000 units. We are doing this subcutaneously every 12 hours, and he has not had the injection yet, so we are able to do the injection. I'm going to choose the proper syringe. So we are going to use the 1 milliliter TB syringe with the 25 gauge by 5/8 needle. So now that I have the correct needle we're going to be using, I'm going to clean the top of the vial. And when I take the syringe out, I'm going to leave the cap in there for easy recapping. Since we are doing 0.5 milliliters, I'm going to inject 0.5 milliliters of air into the vial. And then I'm going to recap using the scooping method. And then I'm going to bring this over to show my that's 0.5 milliliters. And so now that we did that, I'm going to compare the syringe and the medication to the MAR. So we have heparin, and since this is 10,000 units per milliliter, I have 0.5 milliliters for 5,000 units, which once again I would verify with another nurse. And we are doing this subcutaneously every 12 hours, and he has not had the injection yet, so we are able to do the injection. So now I'm going to place my pre-made label. So we have Jaguar Jones, heparin 5,000 units, and we are doing it subcutaneously every 12 hours, and he has not had the medication yet, so we are able to do this. So I'm going to go to the patient's room with my MAR and my syringe with my pre-made label, and I do have to touch my computer to move over to the patient's room, so I'm going to touch my computer. So now that we are in the patient's room, what I'm going to do is I'm going to perform hand hygiene while introducing myself to the patient. And now I'm going to verify the patient by two identifiers. So we have Jaguar Jones, birthday 8/25/1963, birthday 8/25/1963, and he is allergic to penicillin. Allergies include penicillin. And so I did compare that to his wristband. And so now I would ask him what type of reaction he has to penicillin and if he has any other known allergies, which he does not. So we were able to do this administration because it is not penicillin. So at this point, I would do any pre-administration assessments that I would have to do. Examples of pre-administration assessments for this medication would be a platelet count, a hemoglobin, an APTT or a PTT. So I would do that and anything else I had to do. And so now we are going to compare my pre-made label to my MAR. So we have Jaguar Jones, heparin 5,000 units, heparin 5,000 units, subcutaneously every 12 hours, and he has not had the injection yet, so we were able to do this injection. So I'm going to put my label to the side because we already verified it. And so now I would explain the procedure to the patient. I would position him comfortably, and I would raise the bed to a working height and lower the side rails. When I position him comfortably, I want to be sure that he is comfortable in the position where I'm properly able to do the injection. So where I want to do this injection is in the abdomen. And when you do it in the abdomen, you want to stay below the costal margin, above the pubis area, and inside the anterior superior iliac spine. And you want to stay 2 inches away from the umbilicus. So I position him where I'm properly able to do that injection. So now I can put on my gloves and goggles. And so now that we already verified it and we have him positioned comfortably, I can clean the injection site. Then have this pointing to where we cleaned. And so for a subcutaneous injection, you want to pinch the skin. So I'll pinch the skin, and you want to enter at a 45 to 90 degree angle, depending on the amount of skin that is there. So I'm going to remove the cap. I'm going to pinch the skin. And since we do have a lot of skin here, I can enter at a 90 degree angle safely. And then I'm going to apply pressure without massaging, and I'm going to discard this in the sharps container. And at this point, I would assess him for any initial allergic reaction, which I do not see any. And so now we are going to reposition him comfortably, lower the bed back down, and raise the side rails back up. And so I'm able to remove my gloves. I do have a trash can right here. I'll remove my goggles and perform hand hygiene. So since he did not have an initial allergic reaction, I'm able to leave the room, but I would have to come back in the allotted time frame to assess him again for an allergic reaction. So I'd come back in that allotted time frame and reassess him. And so now I'm ready to document on the MAR. So documenting on the MAR, I want to put the name of the patient, the time of administration, the amount that was administered, and my initials so people knew who gave the injection. And also another thing I would include on the MAR is how he handled the procedure, and I would include if he had any allergic reactions, if he did have any, and that concludes my medication administration.